Hello, everyone. Thanks for joining us. It feels great to spend time with you. You are successful doctors, and this comes with many challenges. You multitask with patients, referral networks, peers, and the public. On top of this, you have to keep up with clinical updates and deal with business and clinical processes. There is a lot to do on a normal day. A typical specialist practice is very busy, crowded, and stressful. It is very important for specialists to provide person-centered care, monitor and manage clinical outcomes, and deliver continuity of care. Providing such holistic care is satisfying to both you and the patient. As a natural outcome, this leads to more referrals. Over time, this leads to patient overload. For this reason, implementing and sustaining good medical practices becomes yet another challenge. Though practices evolve over time, change is usually slow. Bottom line, all this is resource-intensive, tiring, and challenging for you and your clinical staff. Success often comes at the expense of the doctor's time and the sacrifice of their work-life balance. You can future-proof your practice with the right technology. Technology can help you confidently weather current and future challenges. It's time to leap forward, to make your practice more efficient, better organized, and more patient-friendly. Technology solutions can bring order at work, create more personal time, boost your income, and get more out of life. Let me present to you the TopDoc Digital Health System. TopDoc is a novel approach to clinical practice, a new way to acquire, triage, consult, and manage patients. It is radically different from others in the market. Using the TopDoc DHS, you can overcome all previously mentioned issues very easily and with little disruption. No two practices or doctors are similar. So we have made TopDoc adaptable to both specialty and doctor's way of practice. Once you subscribe and set up, you can configure the DHS to suit your clinical and business workflows. You can be up and running in just a few hours. Once you log in, TopDoc recognizes your specialty and then opens your custom user interface. Over time, the system learns the way you practice, adapts and transforms itself to meet your specific requirements. TopDoc DHS scales as your practice grows. The specialist enters the DHS through the Master Access portal. Medical officers, diagnostic labs, pharmacy, clinical, and admin staff have portals with different interfaces and restricted views. First, you create your profile. Your website is instantly activated with your custom domain name. Second, set up your clinical and business workflows. Third, set up any labs, pharmacy, and services offered. Finally, enable your inbound and outbound referral networks. You now have created your private practice network. Your very own solution, tailor-made to fit your way of practicing medicine. This removes all delays and bottlenecks, streamlining your patient flow. Some clinical practices have in-house pharmacy and diagnostic labs. Some would have outsourced these services. Others leave the choice up to the patients. Regardless, TopDoc DHS connects and integrates to get real-time clinical data updates. This saves your time, reduces stress, and increases revenue. Let me present to you 3 core features that aid you to navigate the key challenges: patient triage, clinic visits, and remote consults, and the core digital health system. Using the DHS at every single point where patients connect for appointments, triage can be done. This even includes walk-ins. Let us discuss a phone triage example. The patient telephones the clinic or doctor to request an appointment. The TopDoc DHS lets you triage this call into either clinic visit, video consult, or video consult after tests. DHS business processes request for patient info or process payment to confirm the appointment. TopDoc DHS auto-schedules a video consult once online payment is received. Optionally, you may order tests, review results, and then let TopDoc schedule the video consult. TopDoc strictly follows all MCI guidelines for remote consultations. In-clinic appointments and workflows are managed using just-in-time protocols. This avoids overcrowding at clinics. Remote consultations are handy even for clinic visits. That way, patients can go home after giving lab samples. Soon after test results arrive, DHS schedules the video consult. This way, the patient handling capacity can be maximized. It also saves time and money for the patient. Quickly processing follow-up patients is extremely important for the clinical practice. Once the workflow is set, the follow-up patient can be processed, including standard tests, within 30 minutes. This creates extra capacity to take in more patients every day. Optionally, follow-up consults can be handled remotely. Happy and satisfied patients means more referrals. For TopDoc DHS, just-in-time doesn't mean that the doctor has to follow strict timings. The doctor may arrive late, or may get delayed with other patients. He may need to walk in and out of the clinic. When this happens, patients are continually notified of the updated consultation time. This saves the patient the hassle of spending unnecessary time at the clinic. This is beneficial for both you and your patients. Clinical data capture is made easy with TopDoc. You can use speech recognition, handwriting recognition, and fast templating. As you capture data on the fly, you can template a prescription, medical advice, treatment plan, follow-up instruction, investigation request, or a referral request. Using assisted data capture, clinical staff can enter data from recorded audio or video. For remote consults, the transcriber can literally be present in the VC room. As you use the DHS, in no time, your data capture speeds will start going up. Once set, you can enter and print a detailed consultation report with prescription in 45 seconds flat. The Patient Connect is the last link we will be focusing on. TopDoc DHS connects with patients over the web, smartphone, or feature phone using your very own mobile apps. Patient Connect increases sales and revenue by maximizing pharmacy and lab processes. Consult reports and prescriptions are instantly delivered. Chosen medical officers can use in-treatment communication to monitor and manage clinical outcomes. Using smart pill reminders, you can track and record missed drug intake. Patient subscription is essential for a digital clinic. This also sets in patient loyalty. TopDoc charges 97 rupees per quarter as the patient subscription fee. That's just 33 rupees a month. Clinics should collect the patient subscription fee along with their consultation fee. Patient subscription fee covers the cost of messaging, video consult rooms, storage, bandwidth, mobile apps, digitization, and assisted data capture tools. Finally, using TopDoc's Care Matrix, Timeline, Drug Response Analytics, and in-treatment communication, you can manage clinical outcomes and deliver personalized medicine. TopDoc DHS is flexible and scalable. It can be used by solo practices to small and large clinics. Hospitals also can use DHS for both OPD and IPD workflows and data capture. Our DHS is ready for a range of specialities. A scaled-down version is also available for general practice, and dental. It is your practice, your future, your way. TopDoc makes it possible.